All right, welcome back to the Lightning Step Couch here at Global Exchange 2023. I am Benjamin Turner, your behavioral health advocate. Sitting to my left is Maeve O'Neill. Thank you, Maeve, for joining us. She is the National Compliance Director with Circa Behavioral Healthcare Solutions, headquartered out of California. Thank you so much for joining us today.
Thanks for having me.
Absolutely. Can you tell us a little bit about yourself and the organization you're with?
So I've worked in behavioral health 35 years. That's all I've
Hmm.
ever done. I come from a family of addiction and mental health, so I'm really passionate about changing the world for other kids and other people. I'm a licensed professional counselor. I've been a
Nice.
clinician for 37 years. And about 10 years ago, I found my dream job in compliance, taking my clinical, my administration, my operational experience to be able to help other people do quality, safe care. And so about a year ago, I joined Circa,
Hmm.
which is a wonderful organization funded by Devin Waite,
Okay.
who spent about 10 years running a wonderful program out in California.
Yeah.
And he too has a heart and a soul for compliance. So he's got a team of about 10, 12 people, nurses, HR specialists, operational folks. And we get to work with treatment centers across the country. And we help them with licensing, accreditation, joint commission, CARF, ACM, all those things. And then we do their ongoing compliance. So it's sort of like they're a fractional compliance officer.
Hmm.
So once you're licensed and accredited, how do we make sure you stay that way?
Yeah.
And then be prepared for any kind of surveys that happen.
Absolutely. Now, compliance is a major concern within behavioral health care. How can organizations stay updated on changing rules, changing policies, and guidance at the federal, state, and local levels?
Well, that's a great question. I think there's lots of ways to do that, right? There's listservs you can join, there's
Hmm.
webinars you can join, professional associations,
Hmm.
put out lots of good information. I personally feel like the best thing they can do is hire someone like us to do that for them
Okay.
because it's so much. And especially now, we're in a time of like constant change, right? So I think it's a lot having run programs and been a clinician and been an operator. It's too much to ask, I think, of people to
Yeah.
do all of that,
Hmm.
meet all the client needs and the facility issues, and never mind staff needs
Yeah.
to say also keep up with regulations and then update all your work, your policies and your processes
Hmm.
and your practices. I think it's just too much. So let us take that off your plate.
Okay.
Let us do it for you. We can standardize it. We can, you know, make it so that if you have different locations, we can do that for you. We can work with your EMR
Yeah.
to make it part of that. So to me, it's sort of like a specialized service, much like finance or legal or other kind of marketing services. Compliance should be a separate, maybe what's external function rather than
Okay.
try to give it to lots of people inside, try to do it and do it well.
Yeah, that makes sense. There are growing complexities to
Yeah,
compliance, and for those that are just wanting to help others, they may not know how to manage and navigate the landscape
yeah,
there.
it's a lot.
How do accreditation standards align with and support regulatory compliance?
Oh, good question. Well, I used to be a joint commission surveyor.
Okay.
So I love the joint commissions because I truly believe if you do those standards, you'll be more quality
Mm-hmm.
and safe care. That's just the reality. Some of the regulatory rules that we have to do seem kind of burdensome and kind of silly. What we wish was that every state had the same rules.
Okay.
It's
Yeah.
it's weird when you go into Ohio or Massachusetts or Texas and it's all different. What if it was all just the same?
Yeah.
And we just kind of knew it would make licensure simpler. We would all understand it better. If some states wanted higher standards, then we'll figure out, well, that makes sense. Let's just kind of rise to that. I live and worked in Texas for many years, and those regulations have not been updated in 20 years,
Yeah.
right?
Yeah.
So sometimes they're outdated. Sometimes they're over regulating because of some of the bad actors or bad players we've had in the field. So our dream would be to help advocate for standardized regulations so everyone knows what they are, everyone knows how to follow them, and then I think we'll get better care.
Okay. Absolutely. Do you feel that software solutions within behavioral health, whether that be CRM, EMR, or revenue cycle management, do you think that they're doing enough to manage compliance, or is there places that we can be better at that?
Oh, wow. Well, I think technology is always great if it makes the life of the clinician easier.
Mm-hmm.
Oftentimes we hear sort of the horror stories, right? It makes their work harder.
Yeah,
There's constant changes. They don't quite know how to utilize it. So I think if it makes their job easier, it's always a good thing. So I think
absolutely.
any system that has the user in mind and makes it better. And then, of course, the system has to also do that, the
Hmm.
operational system. sometimes I've worked in places that have a new EMR and a new this and a new that and a new phone system, and information overload. Right?
Absolutely.
And I think as a licensed clinician, I can say we're not always good at that stuff.
Yeah.
We're not
Yeah.
good at
Yeah.
technology stuff or even documentation. We're not good at. So we need all the help we can get. So our job as compliance is to make all that simple. How do we make it so it's easy? It improves the workflows. I don't want to ever cause duplication or complication. I want to
Yeah.
make their job easier. So if an EMR or anything can also integrate the regulatory stuff, that's great. Like you have to document this for this reason, for drug commission, for the state, for CARF, whatever it is. Like this is why you have to do this.
Yeah.
It makes sense. Then.
Absolutely.
That helps a lot.
Absolutely. So using multiple software solutions within the organization tends to complicate things, correctly? Yep. So if we were able to streamline that process, integrate them all together, it'd make that center's job easier and make your job a little bit easier as well to benefit them. Um, One last question. What high risk areas should be priorities for compliance monitoring and audits?
Oh, that's a good question. I mean, there's a gazillion of them, right? I could
Yep.
talk about facility stuff. I could talk about suicidality in clients. We could talk about detox and medical
Mhm.
things that can happen, infection controls, and million
Yeah.
things. But truly, I have a bit of a bias, I guess, in this. And I feel the highest risk is our people.
Mhm.
And I believe in 35 years in this field, we don't take good care of our people in this field. I
Absolutely.
think we assume, well, we're licensed clinicians. We all must do really good at this, and we're not good at taking care of ourselves. And then we work in teams of people that become competitive or sort of unhealthy or whatever happens. And then in cultures that are kind of toxic. So what we see is burnout.
Yep.
I've burned out before, and then high turnover, which results in unhelpful workplaces.
Yep.
So I'm really passionate about compliance being the roadmap to wholeheartedness and resilience. That will lead to regulatory compliance, and therefore I believe high reliability. So our mantra, my mantra, is happy and healthy people,
Yeah.
are ethical
Yeah.
and compliant,
Yeah.
to provide quality and safe care.
I
We
love
have to
that.
do all three.
I love that. Yeah, there's no doubt that staff burnout, compassion fatigue, and high turnover
Yeah.
is a plague within the industry, and we need to do more to address that. We've got to make that easier for them. So, Maeve, I appreciate you sitting down with us. Is there anything I missed in this conversation that you really want to tell folks out there about compliance?
That compliance is not scary.
Okay.
Compliance is really not even that difficult, right? I think people either assume they know it and they're doing it, and maybe they're missing some pieces, so they don't want to admit that or ask the right questions. And it's also something that can actually make your job easier.
Yeah.
If you welcome us,
Yeah.
you let us take off some stuff off your plate, and then make what you're doing more aligned with the standards. It actually makes your job easier, makes the job of operators easier, and people can sleep at night knowing they're all good. If
Yeah.
a surveyor shows up, you're going to be all right.
All right. I think I said last question on the last one, but I got one more for you. Do you, as an organization, do you consult with technology companies to help them better their technology on a compliance standard?
We do. We
Okay.
do very, very often.
Awesome.
Our founder, Devin Wade, is a great advocate of that, and he's done it many times.
Okay. All right. Well, we have Maeve O'Neill with us again. She is the National Compliance Director with Circa Behavioral Healthcare Solutions based out of California. Maeve, it was really a pleasure to talk to you. This was one of the best conversations I've had, and I appreciate your time today.
Right.
Thank you.